So my definition of success for pancreatic cancer is to move the needle, is to improve the survival of patients with pancreatic cancer. If you think about it, the big news last year was that the 5-year survival rate for pancreatic cancer had now increased to 9%. To 9%. So in my mind, the ultimate success, the grand slam, is we need to find a cure for pancreatic cancer, or we need to find a way to identify pancreatic cancer earlier so that we can intervene earlier. But I think in the short term, success in my mind would be defined as really just developing this network so that we can continue to improve the outcomes of pancreatic cancer patients. I think eventually we should all be on the same platform. We should be sharing data together. We should be developing prospective trials that we can run amongst our centers. It's funny, we actually have now put together a potential clinical trial that we'd like to propose to the Canopy Collective Network that revolves around nutrition for patients with pancreatic cancer. I think, to me, success will be ongoing collaborative work, improving and ensuring that all patients get the most cutting edge, best possible pancreatic cancer care, no matter where they are in our country or within our network. And I think ultimately, I want what everyone else wants as a sign of success. I want to improve the outcomes of patients with pancreatic cancer. I think the partnership and the collaboration will by definition accelerate the science. It will accelerate not only the basic science that all of us are interested in with pancreatic cancer, but it will accelerate the science of not only the treatment modalities and prospective trials, but honestly, it will also improve the science of how are we treating the entire patient that we're seeing. What are our patients' quality of life look like? I think that up until now, because each center has, in a lot of ways, been practicing in silos, the progress has been slow. None of us are happy with the progress we've made over the last 50 years in pancreatic cancer. We have to do something different. And by getting this group together, I think in a lot of ways, you're going to have a lot of brainstorming. You're going to have a lot of new ideas that are going to come out. And then you're going to have a platform in order to investigate these new ideas that can get a new idea that's going to be successful into the clinics much faster than if it was just studied at a single institution. I'm super excited. I think there's no doubt in my mind that collaboratives like the Canopy Pancreatic Cancer Collaborative are going to expedite progress in pancreatic cancer. It's going to do two things. Number one, it's going to ensure that all of our patients get the best possible care. We all think that we're providing the best possible care, but we can work together to improve it. We can always improve the care that we're providing. But the second thing that it'll do, and perhaps equally as important, is that it will accelerate the way we investigate pancreatic cancer, looking for new treatments and new modalities. And I have no doubt that we'll be successful. So it's interesting. One of the problems that we've had for many years at multiple institutions that I've worked is the obtainment and the management of data. Right? When you think about the way we currently treat pancreatic cancer, we sit around in a room, we talk about a patient's individual situation, their age, their presentation, their tumor markers, what their CT scan looks like. And frequently we decide on how we're going to manage them based upon our own experience. So it's, thinking back and thinking about how we treated the last patient, or maybe treated a patient a year ago that had the same kind of qualifications. And I think we all know that big data is now here to stay. What we really should be doing is we should be capturing our data. We should be sharing our data with each other, like the groups in the Canopy Collective Network, and we should be utilizing that data in order to predict how we should treat the next patient. And so one of the early wins that we had, I think, is all agreeing upon, what are our data endpoints that we want to capture as a group. How are we technically going to obtain them? For instance, at our site, we almost a year ago, we started with templating certain notes so that in our electronic medical record, we have all the data that we want to capture in our research database. And we shared that with the group. And now we're working towards having essentially a collective way that we can obtain the same data points and that we can then have the ability to analyze these data as a group and move forward. I think that one of the very, very early success stories is the fact that we very quickly agreed that obtaining data is very important, that some of us do it better than others, and that we can learn from each other going forward on how we can do this together and then share the data so that we can, not only improve the clinical outcomes of our patient, but in order to do so, obtain research data points. So I think that's been a huge success. We also now have the opportunity to work with some, through the Canopy Collective Network, to work with some really smart IT folks that can help us with that. I'm a clinician. I'm not an IT specialist. I have managed many databases in my time, but now I have the expertise, through this network to obtain the data that I need and to do it in an unbelievably sophisticated way. So my personality is the eternal optimist. I chose to go into surgical oncology for a reason. I like to say I love to operate and I hate cancer, but I also chose to dedicate my life to pancreatic cancer because, truthfully, it's one of the cancers that needs the most attention right now. I'm the eternal optimist. I have no doubt that in my lifespan, we are going to dramatically improve the way pancreatic cancer patients survive. I think there's always hope. I think that we've made tremendous strides in the last 10 years, in particular with pancreatic cancer. Systemic therapy for pancreatic cancer has improved dramatically. It's still not perfect, but it has improved to the point where now it is both effective and it's better tolerated than it used to be. I think that radiation therapy has changed dramatically in the last 10 years. We give much more effective radiation, more focal radiation with less toxicity and less side effects. I think surgery has improved over the last 10 years. These operations, when they were first described, used to take 2 days and half the people died from the operations. Now these operations, depending on which operations performed, take anywhere from 3 to 4 hours. Patients are in the hospital for a week. They do pretty well. They recover pretty well. And now we're even doing a lot of these operations minimally invasive. I do a lot of my operations robotically. That wasn't the case 10 years ago. So I think all three of the biggest modalities that we use to treat pancreatic cancer, chemotherapy, radiation therapy, and surgical therapy, have all made great strides in the last 10 years. And I think as all three of those improve, I'm very optimistic that in the next 5 to 10 years, as the science now is improving rapidly, that we're gonna move the needle, that we are gonna increase the good outcomes of patients with pancreatic cancer.